Hi, so we are group 15 for Informatics 171. My name is Candy.
I'm Jasmine.
I'm Danica.
Ciao. And I'm Amberly.
What is an EHR? EHR are longitudinal collections of health information about individual patients or population. They combine data from different sectors of healthcare, such as radiology, laboratory results, physician orders, nursing notes, and pharmaceutical information. The shared network enables changes in a patient's condition or information to be seen in real time. The benefits of transitioning paper data collection into electronic databases include reducing costs from environmental damage, increasing physician efficiency by keeping physicians updated, and promoting evidence-based data through the collection of long-term trends.
The current application of electronic healthcare records in healthcare is in complex clinical environments in which the use of the certain data may be used for different purposes, and EHR can help administrators with obtaining data for billing, help physicians see trends in the effectiveness of the treatments they provided their patients, as well as help researchers analyze the efficacy of certain medications to see if they need to be improved or not. The EHR system can be used as a reservoir data for professionals to use and can be very helpful in each aspect of the work and can also add to EHR. EHR represents the integration of healthcare data from each participating collection for a single patient. This is innovative as it allows to see the individual through different perspectives and have a better coordination of care for the patient. One thing that needs to be considered in the use of EHR is the plan for long-term preservation and storage of records. A consensus needs to be come up with for the length of time to store EHRs in order to ensure the future accessibility and compatibility of data. This can be a very difficult process because there is high possibility of the data being used longitudinally and being integrated across sites of care. So there must be choices made on the structure as well as the ownership of the record, since this will have an impact on accessibility and privacy on the information of patients. The required length of storage of individuals' EHR will depend on national and state regulations, which can range from 20 to 100 years of preservation. A proposed solution for long-term preservation is to standardize information fields in a time-invariant way. EHR systems have many components. These systems are designed to combine data from large ancillary services. These include administrative systems, laboratory systems, radiology systems, pharmacy systems, computerized physician order entry, and clinical documentation. The integration of all the data from each of these ancillary services will allow accurate patient identification and assessment and allow individuals' health information to be aggregated for use in clinical analysis and research.
People feel that health information should be private and should be protected during electronic health transactions. An example of some measure that would do that is HIPAA, the Health Insurance Portability and Accountability Act of 1996. Because there is a concern for data to be hacked, manipulated, or destroyed due to its interoperability, one approach to protection is access control, making sure only authorized individuals have access to data. An example of this would be to have passwords or PINs to access information only available to patient staff and insurance companies. Accountability should also be considered because about 12 million people need to access the network, so there is a risk of massive security breach and anyone who is involved in the electronic transactions.
So what does CPOE stand for? CPOE stands for Computerized Provider Order Entry, and this is an electronic prescribing system that is meant to intercept errors when they most commonly occur, which is when the medications are ordered. The reason why CPOEs are implemented in the hospital setting is to increase efficiency, and in addition, healthcare providers are able to submit orders electronically to different departments. Computerized physician order entries are supposed to reduce the likelihood of medication errors, but there are still fatal errors, and this can be seen in the statistic shown in the slide, in which CPOE systems failed to send alerts for 39% of potentially harmful drug orders and 13% of potentially fatal orders.
Hospitals sometimes don't add new treatments or guidelines to their CPOE systems, nor always ensure that the medication lists are up to date. This is a glaring issue because some medication have interactions with certain types of medication due to different effects, either amplifying, conflicting, or reacting together in a dangerous way. The article suggested that hospitals should work with their health IT vendors and clinical leaders to improve medication reconciliation and avoid errors. Hospitals also need to double and triple check orders even if they believe their CPOE is well functioning to help fix this issue.
The future implementation of EHR will be able to reach a vast range of people, including the patients, clinical research centers, public health officials, healthcare financiers, and individual healthcare nodes. These healthcare nodes include small practices, clinics, pharmacies, labs and imaging centers, hospitals, home health, and long-term care and nursing. For example, by using electronic data sharing networks, patients who receive referrals can easily have their information shared and updated. The diagram above depicts a vision that may soon become reality with the implementation of EHRs.
Although I have never experienced electronic healthcare records, this type of technology is very innovative and can be very helpful in terms of healthcare. Coordination across professionals will allow for a better assessment of patients, which can be very beneficial.
I remember going to my doctor. I had no idea how to use the new sign system, and even the front desk representative didn't know what exactly going on there. It was a huge issue for the patients, and I'm so glad that AHR has been changing so much, and even now that they're partnering with great companies like Intel and Microsoft to improve technology.
From personal experience, using electronic health records make my doctor appointments more efficient, and that if I ever needed a blood test, my doctor could send the order online, and then once the results have been examined, we would both get the test results from the portal. And that way, not only does he get a copy, but I also get a copy.
EHR is very practical. However, from my experience in helping clinics transition into EHR systems, there's a large amount of manual data inputting. In addition, in order for alerts to be used appropriately and effectively, files cannot simply be scanned and uploaded. Alerts often have hard-to-navigate interfaces and should include greater designer feedback in the EHR development process. Some of these issues are font size and overwhelming presentation of information. If the font is really small, the information will be too hard to read comfortably, and bad organization makes it difficult to find the information needed at the moment or make it easily missable.